Okay students, now we are going to study left-sided heart failure. So what happens in case of left heart failure? There is basically the problem in the left side of the heart. Okay, the problem remains the same: the myocardial infarction, hypertension of body, and then we have the valvular heart diseases, which may be of mitral valve or the aortic valve now, and then there could be the arrhythmia. Okay, so the causes remain the same. Now see the pathophysiology, that if there is a left-sided heart failure, so basically the blood cannot be pumped from left ventricle to the body. Ultimately, there is a lot of blood in the left ventricle, and blood pressure in the left ventricle increases, and that pressure pushes the valve and the valve opens. Okay, so blood backflows from left ventricle to the right ventricle. The blood was coming from lungs through the pulmonary vein into the right ventricle. So now the blood will backflow from right ventricle to pulmonary vein. Then pulmonary vein, and then we have the capillaries. What would happen? Capillary hydrostatic pressure will increase. Basically what happens, that this pulmonary vein, this is the vein, then it forms the capillaries. Okay, and these capillaries are basically surrounding the alveoli. Okay, and then there is oxygen and carbon dioxide exchange between So now what happens, that there would be the backflow of blood. Okay, so on one side we have the pulmonary artery, and on the other side we have the pulmonary vein. Pulmonary artery was carrying the deoxygenated blood, become arteriole, and then capillary. Capillary is arterial end, and then the pulmonary vein, which was forming the venous end. Okay, so now the capillary hydrostatic pressure will increase, the fluid will leak into the plasma, so there would be a lot of plasma in the interstitial space, or we may say that there is a lot of fluid into the interstitial space. Okay, and then what will happen, it will ultimately cause pulmonary edema. Very, very important. I told you, if there is any sign or symptom related to the lung, that would be the left-sided heart failure. So pulmonary edema is the sign of left-sided heart failure, while the peripheral edema, that is the sign of right-sided heart failure. Okay, so this is the pathophysiology. The blood will backflow from left ventricle to the right ventricle, and then to pulmonary vein, capillaries. Capillary hydrostatic pressure will increase. There will be a lot of fluid accumulation in the interstitial space that will ultimately causes pulmonary edema. I have already told you the causes. There are a lot of other signs and symptoms related to the left-sided heart failure. There is a condition which is termed as you know, that there is a lot of fluid build-up in the lungs. So that will cause a congestion, stuffness, like your nose congest and you can't breathe. Okay, similarly your lungs congest, there is a lot of fluid accumulation, and then you have a problem which is termed as dyspnea, means shortness of breath. Please focus on these terms: shortness of breath. And dyspnea is shortness of breath, no matter you are what is the position of your body. Okay, but there is a term which is called as orthopnea. Orthopnea is basically same, it is the shortness of breath, but when you are lying down. Okay, but you are awake. Okay, lying down but awake. And there is a term which is called as paroxysmal nocturnal dyspnea. Now what happens in this paroxysmal nocturnal dyspnea? Firstly, get the meaning of this word. Paroxysmal basically means recurrent. Okay, and nocturnal means the one which is active at night, like owl is called as the nocturnal animal because it is active at night. So it is basically related to night, and dyspnea is breathless problem. So basically paroxysmal nocturnal dyspnea simply means that you have the shortness of breath while you are sleeping, and it is recurrent. It is frequent. Okay, so when you have the shortness of breath despite of any position, that is dyspnea. If you are specifically when you are lying down and you have a shortness of breath, that is specifically termed as orthopnea. And while you were sleeping and there was a lot of congestion in your blood, in your lungs, and you can't breathe while you are sleeping, and you just wake up having a lot of cough and sneezing, that is termed as paroxysmal nocturnal dyspnea. That is the shortness of breath while you are sleeping. Okay, so these are very important terms, and all three of them happens in case of left-sided heart failure. And this left-sided heart failure with pulmonary edema, it is an emergency, because whenever there is a lot of shortness of breath, that is always emergency. So this is basically an emergency. Got it? And then there is also confusion, and there is also one more term. Sorry, there is tachypnea. Tachypnea simply means that you take breath very rapidly, rapid respiration. Because if you are having a shortness of breath, then what will you do? You will try to do the forced inspirations. Okay, so and you will try to do very rapid respirations. So basically, this one is the rapid inspirations. Okay, rapid respiration. Okay, so that is basically the tachypnea. Okay, and there will also be the rapid pulse, and confusions are there. The person is not very alert, so the confusions are there. Otherwise, these fatigue, weakness, lack of energy, these all are the common symptoms, signs and symptoms of right-sided and left-sided heart failure. Okay, so what happens in case of left-sided heart failure? That firstly there is pulmonary edema, secondly there is dyspnea, third there is orthopnea, there is paroxysmal nocturnal dyspnea, there is tachypnea, there is confusions, there is the rapid pulse. Okay, these two are the most important ones: left-sided heart failure and the right-sided heart failure. And we have the systolic heart failure and the diastolic heart failure. Systolic heart failure simply means that your heart is not able to pump the blood normally. Okay, it means it is related to the contraction problem, it is related to the contraction problem, and it is related to the relaxation problem. So this is contraction problem and this is relaxation problem of heart. See, what if your heart is not able to contract properly? That will not be able to pump that 5 liter blood. Okay, so that will ultimately lead to cardiac failure. What if your heart is not filling properly? Then ultimately there is low blood in the atrium and low blood in the ventricle and low blood in the body. That will lead to the cardiac failure. So this is a contraction problem and this is a relaxation problem. What happens in case of systolic heart failure? In case of systolic heart failure, basically your ejection fraction decreases. Ejection fraction simply means, see, that your ventricle has 130 ml of blood approximately 130 ml of blood at the end of the diastole. Now out of this 130 ml, only 70 ml is pumped out. Okay, so this 70 ml is called as stroke volume, this is called as end diastolic volume, and that percentage of blood, which is approximately 60%, this percentage of blood which is pumped out of this 130 ml, that is termed as ejection fraction. Now in case of systolic heart failure, what happens? And this ejection fraction, the formula of this ejection fraction is stroke volume over end diastolic volume. Your stroke volume is less than normal. Okay, it is not 70 ml. Let's suppose it is 44 ml. And your end diastolic volume, that is normal, because end diastolic volume depends upon the filling of the blood. Your atrium were normal, so your blood was filled into the ventricle normally, but your ventricle can't contract, so the end diastolic volume was normal, but your stroke volume decreases, so that is approximately 130 ml, and your ejection fraction is approximately 51%, while normal ejection fraction is 60 to 70%. Okay, so your ejection fraction, basically it should be less than 51%, sorry for my mathematics, but there is a condition where stroke volume decreases to that quantity that your ejection fraction is less than 50%, that would be the systolic heart failure. Okay, what happens that in case of diastolic heart failure, your ejection fraction is normal. Why? Because your heart is not filling properly, the blood in the atrium is less, so the end diastolic volume will be less, and ultimately stroke volume will be less. So when you will find out the ejection fraction, stroke volume over end diastolic volume, both quantities have been decreased. Ejection fraction is normal, 60%. Like if I give you example of diastolic heart failure, for example, if I have the stroke volume of 44 and end diastolic volume has been decreased because blood is not, the diastole was not proper, and diastole is the filling phase of the blood. Okay, so diastole was not proper, so the blood was not filled into the ventricles proper, so ultimately the end diastolic volume has been decreased, which is, suppose firstly it was 130 but now it is 69, and the answer will be 64%, which is exactly normal. Okay, so both of the values when decreased, so the answer will be the same. Okay, so in case of diastolic heart failure, the ejection fraction is normal, end diastolic volume decreases, stroke volume decreases. And one more important thing, in systolic heart failure, the stroke volume decreases, it means the end systolic volume will increase. End systolic volume means the volume of the blood left in the ventricle after it has pumped the stroke volume. Okay, so 130 minus 70, it would be approximately 60. Okay, so this 60 ml is basically the end systolic volume. So when the stroke volume is less, okay, this is normal. Okay, so when the stroke volume is less, suppose it is now 44, then ultimately this end systolic volume will increase, so the stroke volume decreases, end systolic volume increases, ejection fraction also decreases. In case of diastolic heart failure, ejection fraction is normal, end diastolic volume decreases, stroke volume decreases. I hope that you have got the lecture. Other types are less common, so you will just do it by yourself. I have told you some of the most important types, and please do remember the signs and symptoms. And if you like the video, then give it a big thumbs up. Subscribe to my YouTube channel. See you in the next video. Allah Hafiz.